When it comes to ICD-10, what are some of the benefits to population health of using ICD-10 over ICD-9?
Well, ICD-9 is a fairly old system, so it doesn't contain the codes that are current in use today, so for interventions. And at the same time, it doesn't have a level of specificity that will allow great analytics. So when you can go to ICD-10, you have the dual benefit for the US of not only having billing codes, but you also have a great resource of codes that can actually be mined and manipulated to tell you things about the population that you're dealing with. So I'll give you one example in northern British Columbia where I worked previously. What they did was they took a look at the coding and the accident codes for people who had come into the emergency department. And what they tried to do with that information is that the accident codes in ICD-10 are very specific, and so they could really figure out if the person was in a car accident, if they were driver, passenger, wearing seatbelt, not wearing seatbelt. They could tell if it was a hunting accident. They could tell if it was a snowboarding accident. So for all those communities, what they did is they took a look at that data and they pinpointed town by town what their specific big accident item was, and they actually put in public health training sessions and education sessions for the public to be able to target preventative safety for those things. So if it was seatbelt, then they would do a seatbelt campaign. If it was snowboarding accidents, they would do a wear helmets campaign, or bicycle helmets, or bicycle awareness, or whatever it was for that particular community. And it had a huge effect because it actually prevented people from visiting the hospital in the first place. So that's one very simple example.
Thank you.